Good morning, everybody, and welcome to the fourth and last installment of our series on population health's past, present, and future. It's really a pleasure to be with you today. I'm Arjuman Siddiqui, one of the co-hosts of this series, and we're really delighted today to transition from the last three sessions, which have really been about the science of population health, to today's conversation, which is really about how that science is translated into policy and political terms. This is something we've actually heard a lot about during the last three sessions, and this need to have more of a linkage between these ideas. And so I'm really pleased to be able to host this session today. I'd like to start by acknowledging the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. As we gather to think about population health and health inequalities and the interventions that can overcome inequality, I think it's well worth thinking about what these words mean and what the implications are for reparative action. I'd like to start today by introducing our first speaker, Dr. Staney Brown. Dr. Staney Brown is the Dean of the Dalla Lana School of Public Health at the University of Toronto. He has worked with decision makers in Ontario and elsewhere to develop research and capacity development programs in performance measurement, quality improvement, and leadership. Prior to becoming the Dean, Dr. Brown was director of the Institute of Health Policy Management and Evaluation at the University of Toronto, and he's also been head of strategy for the Ontario Ministry of Health and Long-Term Care, the head of policy and science for the Ontario Ministry of Research and Innovation, and has held many other roles, including his most recent roles spearheading many of the COVID science initiatives in Ontario. So with that, I'm very pleased to introduce to you Dr. Brown.
Thanks very much for the kind introduction. So I was asked to talk about the factors and processes based on my experience that facilitate science-informed policy, about the relationship between the scientific community and policymakers, and what, if anything, we should be doing differently. I'll start with the assumption that both scientists and policymakers want more science and policy. That's an assumption. We could frame this as an argument that rigorously produced scientific evidence should have a privileged role in policy development. And although it may seem self-evident to scientists and even to a number of policymakers that rigorous and high-quality evidence should have such a role in the policy development process, I don't believe in any way that this is a universally shared belief, nor do I think it's always correct. And moreover, policymakers often feel a pressure to decide on a course of action, whereas scientists are encouraged to note uncertainty in clear terms. Maybe put even simpler, sometimes a policymaker needs to do something, and a scientist needs to say that we don't know what to do. But leaving that aside for a sec, when we say we want more science and policy, maybe we're saying something more than just a claim that scientific evidence should guide policy. We might also be saying that scientists should have a role in advising on policy, particularly in how we sort through different types of evidence and other inputs into the policy process, and how we evaluate and understand the success or failure of policies. And I think this is a very appealing argument. If you read through, and I've been doing this last little while, some of Professor Hamilton's work, I can easily imagine a politician turning to him for advice on a complex issue and getting wise counsel that builds off of Professor Hamilton's training and work, but it's not a direct extract from that work. Likewise, with Dr. Matthews, we have an example of a successful politician and reformer who started professional life with a scientific training. But at the same time, we will also keep in mind a large segment of our society distrusts science and regards science itself as founded on ideological assumptions that run counter to their own belief systems. And one only needs to turn to social media, one only needs to turn to Twitter or any other sort of platform to kind of see these arguments playing out about whether or not science is how we usually think about it as science, or whether itself is just another belief system that has its own challenges. But let's build on my original assumption for a minute, and that is that science and even scientists should have a strong role in policy. When we think about this assumption or argument, we immediately turn to the first question that was asked to me, namely, what factors and processes facilitate science-informed policy? And we can ask, and we should ask almost as quickly, what has science actually learned about that question? And so frameworks ranging from integrated knowledge transfer through to community-embedded research clearly point to the success in developing insights when different groups of people are engaged right from the start in the scientific process. Policymakers and scientists, community members and scientists, patients and scientists. I don't know if we've ever had a systematic review of whether these approaches have led to more implementation of these insights, but I do believe we need to interrogate them. We do not need to interrogate them any further. If for no other reason, community embedded and engaged research or patient engaged research is supported by a clear ethical imperative, and integrated knowledge transfer is a reasonable expectation of any research funder. They should have some engagement early on in how we frame the questions that they're supporting. So I'd like to leave behind for a minute the literature around these topics and talk to a different set of issues. Namely, what factors and processes lead scientists and policymakers to work well together? As I believe these factors are very different from those that dominate thinking about, the aforementioned evidence-informed policy frameworks. And to get to these sorts of factors about what makes that relationship work well, I'll focus on three key issues: the policy context, and particularly the role of crises, the scientist's own softer skills or interpersonal skills, and the university's culture and principles. Let's start with the policy context. I think we have a clear and extreme example of the importance of context with the COVID-19 pandemic. Jurisdictions that have had strong scientific communication, typically led by scientists and focused on data, have had a stronger ability to engage their populations in their approach and to garner support for their policy directions. This is regardless of the policy direction and is as true in Sweden as it is in Australia. And there's even a very sort of elegant review in Nature the other day that looked at the different components, and this sort of clear science-informed communication was actually one of the things that seemed to be leading to better progress against the disease. But there are other areas where context is key that do not involve a crisis. Let's take a different example. Countries around the world have adopted legislation and other policies to improve the quality of care. In almost all of these situations, despite the tremendous cost of poor quality, it would be hard to argue that the quality of care is seen widely as a crisis. What is interesting in each of these situations is the role that scientists have played in terms of organizing input into the policy process, organizing support for policy options, and advocating both publicly and privately for different policies. In both the crisis and the non-crisis examples, the role of science has been to create a more firm foundation for discussion by bringing together both scientists and system leaders, and by fostering a context where discussion and collaboration can occur in a more neutral and hopefully objective setting than the typical policy briefing session or presentation to a legislative committee. So, what can these examples say about how we advocate for the continuing evolving science around the social determinants of health? Well, I think the first is to look at what has worked. If we look at experiments that improve the social determinants of health, they've had a strong support from the types of coalitions that scientists have been able to foster or support. A good example here would be the basic income experiment that started, but then unfortunately stopped here in Ontario. Another example might be the recent reinstatement of the eviction moratorium in Ontario as part of the COVID-19 response. In each of these cases, we've seen the creation of a space for discussion, whether it was on point with what the broader public sentiment was or not, whether it was on point with what the policy agenda of government was or not. And in these cases, even without a crisis or the type of way that we'd look at crises typically, we've been able to get some movement. Let me turn to the second issue. So moving away from kind of the context of whether it's a crisis or not, let me turn to the second issue, which is that of scientists' own skills. And I'll touch on two issues here. The first is the communication skills of the scientist. This is particularly key. Now, not every scientist will or even should want to be a strong communicator. But those who are able to communicate scientific evidence with all of its nuances, who are able to communicate in a way that makes it clear that science is a process, will be able to insert science more easily into policy processes on a regular basis. Those who are strong communicators but focus more on a specific piece of evidence may be able to advocate successfully for this piece of evidence to have a role in the policy process, but they may not be able to sustain this advocacy because, as we all know, evidence evolves. And to advocate solely for a piece of evidence rather than sort of a commitment to a process of science as it works through, in the end of the day, may be somewhat limiting. Perhaps a more important issue, though, than the communication skills is the actual relationship skills of the scientist. A number of years ago, Moria Ellen and I considered knowledge transfer from the perspective of game theory. And the insight that I really need to attribute to Moria was that knowledge transfer is always mediated through a relationship. And the stronger relationship, the stronger the trust between the scientist and the policymaker, likely the stronger the knowledge transfer or exchange. But what was really interesting that she discovered from the game theory literature and what she extended from it was that it's the extended exchanges between individuals that build that trust. This means that scientists have to invest the time to build relationships. And this is not something that's built into the usual way we allocate our time. The 40-40-20 rule of 40% time on teaching, 40% time on research, and 20% on largely internal service does not really account for the time spent responding to phone calls, setting up Chatham House dialogues, and all the other tools that we use to engage policymakers. It does not in any way speak to the question of Twitter and social media and what their role should or should not be in policy discussions. And so, it's an issue of building relationships and investing time in relationships that allows for repeated insertion of evidence into policy processes when it will be helpful. So what do we take from this when we think about the social determinants of health? I think this is where we need to focus on how we train scientists. For a few years now in Canada, a number of us have been working with the Canadian Institutes of Health Research to create the Training Modernization Project that provides additional training to doctoral and postdoctoral fellows in health services and policy research in a diverse set of areas that go beyond the typical canon, ranging from leadership to advocacy to networking. Well, these fellowships undoubtedly make the fellows more attractive to a wide range of employers and help build a health system. The original motivation, at least for my involvement, was the comment by one of our graduates we interviewed when we were getting ready to do this work that they really valued their education, but they were just not able to have the impact that they had hoped for. If we're going to expect the evidence that we generate to have a greater impact, we have to equip the individuals who create and share this evidence to be stronger advocates. And so this takes me to the final issue, and that is the role of the universities or research institutes' culture and principles. Simply put, scientists, despite whatever jokes we make at our own expense, are people too. We work within constraints and the incentives facing us. The moment that a university or a member of its leadership makes it clear that academic freedom is anything but sacrosanct, it reduces the ability of scientists to interact with policymakers with integrity and confidence. The minute that a university or a minute of its leadership focuses evaluation and promotion decisions solely on citation counts or grant dollars, it reduces any interest in engagement with decision makers. And the importance of these principles and culture have been made clear on numerous occasions during the current pandemic. But it has an important lesson for us as we think about the social determinants of health. Increasing the role of evidence in policymaking around the social determinants of health is likely one of the greatest challenges of knowledge transfer and exchange. In some large measure, because the complexity of the issues that policy makers face around the social determinants of health, it will require a commitment and sustained advocacy from scientists, shown by my colleagues on this panel, that needs to be recognized in the way that universities recognize and reward achievement. And I'll just close with sort of an insight that came the other day from a postdoctoral fellow of mine, Nakia Lee Foon, who was talking about the response to COVID at the beginning of the pandemic as being essentially a blunt, equity-blind response. And when she said that, we started to think about what it would take to really get to an equity-informed response to a pandemic, so that when the next pandemic comes and the next health crisis comes, we're not using all these blunt tools that, although they may damp down the spread of infection, they actually exacerbate inequities. It would require scientists who work on the social determinants of health to be investing time in actually helping shape a pandemic response framework. And this really, I think, deserves some attention, because this is time that if it really works, we might never actually see the next pandemic. It's time that if it really works, we actually might not see the problems. And the question then becomes, how do we recognize that time? How do we recognize that investment? And how do we recognize that achievement when its actual sort of success is reflected in not much happening? And so I think it's really important that we understand, both the context, but also the skills of researchers and scientists, and the culture in which they work as being key determinants of whether or not we're going to be able to get more science and more evidence into a policy around social determinants of health. And with that, I've probably taken far too much time, and Dr. Siddiqui, I'll turn it back to you. Thank you.
Okay, just so that the audiovisual people know, I can't start my video, so I'll just chat. So Staney, thanks so much for that presentation, for those words. And I think what's particularly helpful is that they help us think about both the process of engagement, but also the kinds of inputs we need in order to make that happen in the future. And I think it'll be really important going forward for all of us to reflect on these competing priorities and sort of context in which we train and which we enter the labor market and so on. So thank you very much. So our next speaker is actually coming to us through a pre-recorded video. Dr. Sharon Friel, who's in Australia, has kindly pre-recorded her material because, of course, it's the middle of the night in Australia. Dr. Friel is a professor of health equity and director of the Menzies Center for Health Governance at the School of Regulation and Global Governance at the Australian National University. She has been the head of the scientific secretariat University College London for the World Health Organization Commission on the Social Determinants of Health between 2005 and 2008, which is where I met her. She is also a fellow of the Academy of Social Sciences in Australia and co-director of a Center for Research Excellence in the social determinants of health equity. In 2014, her international peers voted her one of the world's most influential female leaders in global health. And so with that, I give you Dr. Friel's presentation.
Hello, thank you very much for the invitation to talk with you. I'm Sharon Friel, Professor of Health Equity at the Australian National University. Sorry I can't join you via Zoom live. I'm in Canberra, Australia. I think it would be somewhere in the middle of the night. So delighted to provide this recording. And thank you, Agriman, for the invitation to reflect on the work of the WHO Commission on the Social Determinants of Health, which was quite a few years ago now, and more recently some of the work we've been doing in Australia, which is really trying to understand this intersection between evidence with politics, policy processes, social determinants and health equity. So the Commission, let me start with the WHO Commission on the Social Determinants of Health. So that ran from 2005 to 2008. There were many Canadians involved with the Commission, including Arjuman, the late Clyde Hertzman, Monique Bejan, Ron Labonte, and others. Apologies for people who I might have forgotten. It was a wonderful experience. This is the front cover of the report from the Commission, and we had three top-line recommendations: improving daily living conditions, doing something about the unequal distribution of power, money and resources, and the very important issue of measurement and evaluation, not just of the problem, but of course of the impact of action. So that's what the report was all about. The focus of the Commission was trying to pay attention, return global attention to the social determinants of health. That was not front and centre of people's minds back in 2005, and I would argue it's certainly not front of people's minds now, today in 2021, and I'll come back to that. But we were also trying to shine a light on the importance of the distribution of health, not just the average, and then of course importantly the opportunities for intersectoral action across the determinants of health equity. And the way we set up the commission, ran the commission, was multi-pronged. There were the commissioners, it was chaired by Sir Michael Marmot, and a number of commissioners, and I'll speak about that in a little second. There were the knowledge networks, so globally a range of world-leading academics and others who were part of these knowledge networks, tasked with pulling together the global evidence, not just on the problem, but also on the types of actions that should be taken to address health inequities. There were the country partners, these were the ministries of health in governments around the world, major civil society organisations. We were engaging closely with global institutions, the International Labour Organization, UN Habitat, and many others. And then, of course, WHO itself, the Global Health Authority, but really trying to break down some of those silos within, like any big bureaucracy. I sat with Michael Marmot at UCL. I headed up the little scientific secretariat that was located there with Michael. And really, our role was to try and pull together what was being generated throughout the course of the commission. But let me turn to the evidence base. So there were all of the, as I say, the knowledge networks, that were the titles of them were here on the screen, who were pulling together that evidence, and then other issues where we were identifying evidence globally around a number of other important issues. And I should say, we wrote a paper after the commission where at the start of it we said, if you're really only interested in evidence being the sorts of work that comes through randomized control trials, stop reading this paper, because you won't see it here. RCTs were part of the evidence, but they were not the only thing. We drew on epidemiology, we drew on policy analysis, we drew on case studies, we drew on practice-based evidence, we drew on lay evidence. It really was about being fit for purpose, to make the argument, to demonstrate the pathways, the causal plausible pathways to health inequities, and the types of actions that were making a difference, or that could make a difference. So a major endeavour to pull together that type of evidence that made its way into the global report. But in reflecting on the ways of working within the Commission and the characteristics of what we were doing, it wasn't just about the evidence, it was really about trying to inform an agenda, about trying to enable policy development and implementation. And that takes us into the murky, murky world of policy making, where, as Kingdon reminds us, it's about this cauldron of policy problems, politics, issues, processes, all and evidence, all mixing up together. So reflecting on the characteristics of the Commission and what was important for trying to advance this agenda. So the political elites and the policy entrepreneurs, an important part of policy studies, the commissioners, some of them who are shown here in this picture. You'll recognise, of course, Monique Bejan and many of the other marvellous colleagues who were the political elites. They were the politicians, the ex-politicians, the senior government officials, the global leaders in civil society organisations and within the academy, who were able, because of their authority, their status, their legitimacy, were able to open doors, to speak about these issues, and people would listen, who were sensitizing sort of constantly through their everyday work and quite deliberately sensitizing institutions and other actors to the importance of the issues that we were speaking about within the Commission. So these policy entrepreneurs, vitally important parts of the system for creating change. Another reflection from the work of the Commission was attention to how we framed the issue. So it wasn't one size fits all, it wasn't one way of talking about this issue, it was being cognizant of what was politically socially, culturally relevant and appropriate. So in Kenya, for example, the way the evidence was brought to bear, the way we spoke about the action that might be needed to address health equity was about access to medicines. It was about water and sanitation. These were vitally important issues. And of course, that created a window of opportunity to then speak about some of the underlying issues behind these, but being very cognizant of issue framing. And then I always speak about the executive board just as a reminder of the realpolitik. So the Commission reported, the front cover of the report, in October 2008. And what's important in global health, as many of you know, to get a mandate and to get, for WHO to have a mandate, a work programme and financial allocation is to have a resolution which comes through the World Health Assembly, which takes place in the May each year. And the World Health Assembly is one of the key governance mechanisms of the World Health Organization, where all of the member states get together and agree on the resolutions coming out from that. To set the agenda for the World Health Assembly, that comes through what's called the Executive Board. The Executive Board is made up of 19 member states and holds a lot of power because they decide the agenda, or part of what they do is decide the agenda for the World Health Assembly the following May. So we were working very hard from that October when we reported to bring the papers to the Executive Board that would then follow through to a resolution, hopefully a resolution in the May of 2009. And it would be fair to say that there were a number of countries who weren't particularly supportive of the Commission's agenda, the US included, even though we had 3 amazing commissioners from the US government at the time. But and on the Executive Board, the US was on the Executive Board, and it's a 5-day process. We were due, the Commission's issues were due to be discussed on the Tuesday. Something terrible happened around the world and we got bumped to later in the week. And in that time period, the Obama administration had been sworn in. If the Commission item had been discussed on the Tuesday, the US representative would have stood up and said, no, we don't support this. Because it came later in the week when it was a different administration, the US representative stood up and said, we fully support the recommendations from the Commission on the Social Determinants, and yes, we'd like to see it go forward. And I always tell that story really, I suppose, to researchers to remind us that it is not a linear process from here's the evidence to policy and practice. It's a messy, messy process. Understanding those processes are vitally important, and understanding that sometimes there just isn't a win to be had. In this instance, we were delighted, of course, that the US representative did support this, but understanding the politics and the policy processes, vitally important. And so what's happened since the Commission? You know, so there it was, there was a resolution, there was this report, this global evidence base all brought to bear. I'm not about to do a stock take of everything that's happened since the Commission, but I just thought I'd reflect a wee bit more generally. So within the research world, I think there's been a marvellous evolution of the idea of the social determinants. We're now speaking about, researching about the political and the commercial determinants. So we've gone from an understanding of there's something about society at the societal level that contributes to health and health inequities, to taking that to the politics, to the commercial actors, and I think that's marvellous. We've also seen an evolution in the way we do research, or the types of research questions that we're asking, a move from, and we still do, and it's important that we still do, but you're asking the question of why do health inequities exist, you know, the pathology of health inequities, more towards, well, what are the types of actions that can address health inequities and evaluation associated with that. And I think more so towards, and I think we need even more attention on the question of the how. If we've got a lot of evidence on the why and the what, and I would argue we've got a lot of evidence on the why and the what, we still have relatively little deep empirical understanding of the how to make change happen. And that takes us into politics and processes. That takes us into political science. It takes us into the political economy. It takes us into the sociology. It takes us into the implementation science and systems science. In the policy world, I think it's remained challenging. Certainly I'll reflect from my experience here in Australia, where I just don't think we pay an awful lot of attention at all in policy to the social determinants of health. And if we do, it's selective social determinants of health. So there might be something to do with urban planning and health. There might be something to do with education and health, and that's fantastic. But really, we're not seeing a comprehensive policy framework that addresses some of the big structural issues. Remember the Commission's recommendation of power, money, and resources. And then even where we do have policy that speaks about, on paper, speaks about the social determinants of health, we see a drift at the implementation stage. We see the expression of that policy come through things like these leaflets, and that's about lifestyle, individual behaviour change. So we're still seeing the drift in the implementation stage. So that takes me to some work that we've been doing here in Australia, where we've been examining why does that happen, trying to get some deep empirical understanding of the policy processes, of the agenda setting, the policy development and the implementation stages, working with many wonderful colleagues, Fran Baum, who was one of the commissioners on the WHO Commission, and myself, we are the co-directors of this, but working with Ron Labonte and Michael Marmot and others globally. It's been marvellous over the past 5 years, where we've been doing particularly qualitative research. We've got about 150 odd interviews with government, politicians, NGOs and industry and researchers, trying to understand the policy cycle. I know it's not linear at all, that's just a heuristic to show it, across different policy domains. So existing policies, current policies, and also retrospectively we've been examining policies in trade and labour market, employment, infrastructure, welfare and health, asking the question of how did social health equity get onto these policies agendas or not? And if it did, how did it stay there? How did it travel through in the implementation phase? So obviously I don't have time to go into all of that in detail. I just wanted to give you a sense of what we were finding, and really a very important analysis that we did was around the governance of these policies. So understanding the web of actors. It's not just government, as we know, that are involved in policy making and implementation, public policy making in particular. There's state, there's non-state, there's public, there's private actors, there's health, and there's other sectors, all mixing around in trying to inform the agenda of a policy and, of course, in its actual formulation. And power, I hope have a power paper coming out fairly soon, where really we see the power inequities across these different policies. That goes a long way to influence whether health and health equity does or does not get up there. So you've got different interests, you've got economic interests, you've got social interests, you've got health interests, you've got trade interests, all mixing around, all these different actors trying to pursue their interests, and they're using ideational power, that framing, remember the issue framing that I was speaking about, the narrative, the rhetoric, whether that's publicly facing, whether it's privately facing. We saw ministers using rhetoric through the media that sensitizes the public to cuts that were about to happen in our telecommunications world and what that meant for digital inequities, and we can see that playing out. And then, of course, the institutional power, the structural, the economic inequities that exist by these different interests, the the institutional processes that were open to some and closed to others. And that really matters for how an issue such as social and health equity gets onto agenda. I'll just give you the example of, for Aboriginal and Torres Strait Islander population peoples in Australia, where discussions about policies that were very, very central to those communities were closed to the voice of those communities. Ridiculous. And so policy gets shaped in a way that is absolutely not culturally relevant or appropriate. But at the same time, the coalitions of Aboriginal elders with community groups, with a whole suite of coalitions, claimed a space, and publicly and privately were acting to change the institutional processes that made sure they did get a seat at the table in the reformulation of the policy. So there were wins in there, but vitally important that we understand all of that. And part of it relates to the understanding why might we say, well, why isn't there a social determinants of health policy framework in Australia or elsewhere? Well, what we saw was the dominance of the paradigm, the ideas, the ideology that education market solutions is what we need. We also saw the regulatory chill, that governments were very fearful of introducing policies that might open them up to backlash from industry, from litigation, and so they chilled back. They were less inclined to introduce some of the progressive regulation that would be good for health and health equity, which relates to the power of industry using their economic, their structural, their discursive, ideational power to prevent governments because they were opposing the introduction of some policies. And then what we also heard coming through our interviews with government players was, okay, well, you're telling us that, you know, our public say, yeah, we do want action on these issues. It's very quiet. We don't hear the voices of the public or civil society. And so that relates to almost the final point of what we found in our analysis of these policy domains was the different the formations of coalitions. I speak about them as coalitions of hope and webs of influence, where the NGOs, the researchers, a variety of different actors were raising collective consciousness. Among broad coalitions of unusual bedfellows, it wasn't just the health actors who were talking to the health actors, it wasn't just the social justice actors speaking to the social justice actors, it was the use of industry, of generic medicines with the trade, fair trade advocacy coalitions coming together that helped us see some progress within trade, for example. It was also very important of this fit for purpose evidence using a diversity of sound evidence to illustrate alternative pathways that helped inform the policy development. And we saw really clever framing, and we've seen that. I'll give just the example of Black Lives Matter. So there you've got such an important issue, so you've got a policy issue framed in a way that is very compelling. Black Lives Matter. That's an important use of discursive of power. And of course, what they were doing really is pushing for political commitment. We saw this through each of our policy case studies, where, you know, people say, oh, well, all we need is political will. Well, that's a very easy thing to say. I hope what our analysis has done is demonstrate through these use of different forms of power, understanding the government inertia, and then understanding some of the strategies that can be used to push for political commitment, that culminates in sometimes political will, and of course holding to account, which relates to what we measure. And in our analysis related to the policy evaluation work of these cases, really nothing paying any attention to structural drivers of health inequities. We're just not measuring them, and that really matters. Constant focus right downstream. So that helps reinforce the policy paradigm of an action right downstream. And shockingly, but not surprisingly, just the constant use of measures of theory and of measures from a Western lens. And I think what we're seeing here in Australia, some of my colleagues at the ANU have some lovely, lovely development of indicators for evaluation that draw on a diversity of knowledge systems. So finally, I think we have a very important moment right now with COVID. We've seen health elevated right up to the same level as the economy, and everything that we saw in the WHO Commission on the Social Determinants of Health and the analysis that I've just been speaking about here in Australia has been the economic interest being much more prominent, profit interest being much more prominent than health interests, and now they're right up there, so we've got to take the opportunity of that. The argument, a well-being economy, there's a lovely narrative that's happening globally. We can't let it be captured by a biomedical model, which I do fear about, because certainly in the public discourse, the understanding of the vaccines, of the vaccine of COVID as a 19 as a the disease. So we've got to keep speaking about the importance of a social intervention, of a social model of health to really help us recover. And that requires that courageous government and a very engaged civil society. So I hope that's been helpful in just trying to illuminate some of those the politics and the policy processes that are behind the question of how can we enable action on the social determinants of health and health equity. And I look forward to any ongoing engagement, either drop me an email or via Twitter. Thank you very much.
Well, I wish Dr. Friel was here for us to thank her in person, but certainly are very grateful for that presentation. It's particularly helpful to see a sort of systematic layout of what the sort of processes and factors are that are involved, and to know that that research is ongoing to sort of get a better sense of those things. So I'd like now to introduce to you Dr. Deb Matthews, and it's a great pleasure to have her with us. Dr. Matthews is a former politician. I think one of your sites, Dr. Matthews, says you're a recovering politician from Ontario, Canada. She was a member of the Liberal Party in the Legislative Assembly of Ontario from 2003 to 2018, representing the riding of London North Centre. Dr. Matthews served as a cabinet minister in the governments of Dalton McGuinty and Kathleen Wynne, and she was the 10th Deputy Premier of Ontario in office from 2013 to 2018. Dr. Matthews was elected to the Ontario Legislature by the people of London North Centre in 2003 and re-elected thereafter in 2007 and 2011. Following her 2007 election, she was appointed Minister of Children and Youth Services and Minister responsible for women's issues. In October 2009, she was appointed to her position as Minister of Health and Long-Term Care, and has been working on issues of long-term care, and clearly on issues across a broad range of social factors related to well-being. So it's a real pleasure to introduce to you and welcome Dr. Matthews. Dr. Matthews.
Thank you so much, Arjun. It's a real pleasure to be here. I want to say thank you to those who organized it and who decided to put a recovering politician on the panel. I do appreciate it. I have to say this is a very fascinating question that they've asked me to talk about. How does science translate or not into policy? And I can tell you that during my years in government, this was a source of tremendous frustration for me, because we know so much more than we apply. And the cost of not applying is, there's a human cost, of course, and a financial cost. We spend a lot of money on research, but we don't seem to be able to find the money to apply that research into really changing the lives of people. So so thank you for asking the question. I've sort of put down some random thoughts, and look forward to the Q&A, and hopefully we can get more of a discussion going during that part of the program. So I think that I think there's a great opportunity for more research on exactly that translation. I think we need clinical trials where we tend to call them pilot programs, where you sort of apply and try to measure, but I think we need rigorous clinical trials so that we can actually demonstrate the impact of changing how we do things. So as I say, this lack of applying research was tremendously frustrating for me, so much so that that I actually, when I was president of the Treasury Board, established something called the Center for Evidence-Based Decision-Making. And I wouldn't expect you to know how Treasury Board works. Even people at Treasury Board don't know that, but people come in from ministries and they tell us how much money they need to spend, and then they tell us, you know, where they're going to spend it. I got into the habit of asking what the KPIs, the key performance indicators, were. It was a stunned silence. People did not know what their KPIs were, let alone whether these investments were actually driving any sort of change or improvement. So, so government needs to get a lot smarter about where they spend their money, put their money where it makes a difference, and that's where science has to lead the way. You know, the just a couple of examples where we knew the research would make lives better and save money, but we weren't able to find the money, or not enough money to actually drive the change. So make those investments. So supportive housing is an excellent example. We know homelessness costs us a lot of money. It's more expensive in the justice system, the police, healthcare, the range of ways that homelessness costs us money. And investing in housing, supportive housing, actually is a good business decision to make, but it's not, it hasn't been the priority that it ought to have been. I think it's getting better, but still eliminating homelessness, eliminating chronic homelessness. And I actually led a group that laid out the path how to do that, would make sense. So another issue where, and I'm going to talk about this in a bit, where the public perception doesn't match the science. So managed alcohol programs, for example, we know there's good research that that's a good way to treat people for whom abstinence is not a likely outcome, but there's real resistance to do that. Drug treatment, the same. Safe injection sites have been, again, changing quickly, but the politics of safe injection sites does not match the science of safe injection sites, supervised injection sites. So, so that's something I think really worth exploring. I was inspired by the Washington State Institute for Public Policy. I don't know if that's something you're familiar with. If you're not, I really urge you to go on that website and spend a little bit of time on it. The Washington State Institute for Public Policy. They are government funded, but they are nonpartisan, and their job is to answer questions sent to them by the legislature in Washington State. So, for example, if the state is interested in programs to reduce recidivism for young offenders, they send that question to the Institute. The Institute pulls in researchers. They evaluate what programs already exist. They do a pretty sophisticated cost-benefit analysis, and they show if you invest money in this, you are or you are not likely to get a return on that investment. It's very quantitative, but it should help decision makers make better decisions. So that's why I established the Center for Evidence-Based Decision Making when I was at Treasury Board, to hopefully just make smarter decisions, because there's no end of things I want to spend money on in government. I don't want to waste money. I want to redirect that money. So let's follow the evidence to do that. I want to talk a little bit about Politics 101, what researchers should know about politics. And I will be brutally honest. I will tell you what it looks like from my perspective as an elected person, but also a person who has a strong social justice bent to me. I would say that it is true that almost all politicians want to do the right thing. They are in it for the right reasons. They want to do good. They will bring their own perspective, obviously, to the table, but politicians are good people and they want to do the right thing. Another truth is that all politicians want to get reelected, and they will have one eye on the politics of the issue and one eye on a policy. I think you could draw a continuum and put politicians somewhere along that continuum about whether they care more about the politics or more about the policy. But the question they will ask is, will this decision help me or hurt me to get reelected? So we always have to remember that how we frame an issue or how we approach an issue, we do have to add that political lens. Now, public opinion changes. Supervised injection sites are a really good example of how public opinion has changed over the years, but I think we have to understand that politics matter on these issues. I would also say that it's still really hard to raise taxes. So unless, of course, you're going to raise taxes on somebody else. So raising taxes is hard. So you've got to kind of work, for the most part, you got to work within the money you have, which I'll get to a bit more in a minute. Budgets, governments have two big levers. They have money and they have legislation. So, and they can issue policy, but it's money and it's law that are the levers politicians have. And budgets very much reflect the value of the government of the day. So someone once said, show me your budget and I'll tell you what your values are. That's absolutely true. If you see things like, and it might not even be a cut, but it might be no increase, for example, in social assistance rates, that demonstrates very clearly the value of that government. So no matter what words they may say, if the money isn't there to back it up, then they may as well not have wasted those words. So budgets do reflect the values, and so it's important. It's important when you're doing your work to think about, is there a way we can offset the cost of this if there is a future benefit? Once established, it is very hard to cut a program. It's highly unlikely something will be cut, eliminated, because it's too hard. Politicians don't like to cut. They might starve. They might not increase funding, but so that means that when you want to establish evidence-based programs, you gotta figure out where the money's gonna come from. I'm gonna tell you a quick example. One of the big focuses of my work was improving access to post-secondary education, particularly those who face the greatest barriers. financial, and other barriers. So we came up with a way to completely reconfigure OSAP so that people, a third of the people got all their post-secondary expenses covered, another third got some, and about a third didn't get any because they didn't need any help. So we were able to fund that entirely by eliminating a tax credit that went only disproportionately to the wealthiest people. So when in the whole package, we were able to significantly improve access to post-secondary education without it actually costing more money because we eliminated a tax credit. That made that transformation a lot easier to implement because we knew where the money was coming from. But as I say, solving homelessness is harder because the savings come from policing, justice, healthcare, wherever, and it's hard to take money away from that because there'll be less draw on those services. So that organizing, figuring out where the money's going to come from is part of what we have to do. I want to say that specific to population health, people care a lot about healthcare, and for the most part, the public doesn't begrudge spending in healthcare as long as they see what they're getting for it. Because population health is more prevention than cure, it's harder to communicate the importance of it, which is why we saw a big cut to public health in the last provincial budget in Ontario. Not to be too partisan, but people didn't know what public health did. They knew it didn't affect them individually as individuals. So the government thought they'd be able to get away with a cut to public health. There was significant pushback that was at least deferred, but I don't think it's been eliminated. So population health is different. It's so I think we have to do a better job talking about, and I think the pandemic has been wonderful in this regard, what population health really is and why it's important. So I think you should think of politicians as the intermediary. Without the support of politicians, not much of importance will change. So we have to work at getting support of politicians. Things can happen without the support of politicians. They sneak it in, but if you get political support, you're way more likely to get done what you need to get done. So I'm just going to wrap up with, how do you get evidence-driven practice and programs implemented? One thing that Sharon talked about is and Stanley, I believe too, you need to retail the research language. You need to make it, the public needs to be able to understand what it is you're talking about. I'm not sure whose job it is to actually do that. But you need communicators. We need to figure out who can translate the research into understood language. And then you need to communicate the findings. And I think you need to communicate the findings in communities of interest who already care about the issue, within government. So not just the politicians, but people who work within government, and with politicians. You need to cultivate champions in the community, people who care about the issue, who are prepared to champion the issue, and in engaging media to create this sort of groundswell of support for change. This is all, there's nobody who's in charge of doing that translation. And I've talked to researchers who present me with findings who are, that are, just beyond question. It obviously would be better to do this than not do it. But then whose job is it to actually create the public support for that, or the community support for that? So Anyway, that's I have. This is something I could talk about for a long time. It's fascinating, and I look forward to the Q&A. Thank you.
Thank you so much, Dr. Matthews. I found it really interesting to hear the perspective of someone who's actually been in the political hot seat, and also to hear some of the key areas that we might think about in the future. I think this question of whose responsibility it is a good one, and very much, I think, dovetails with what Dr. Brown had mentioned about training and impact of scientists. So I'm really, really excited to introduce to you our next speaker, who has been able to both accomplish a lot in the science as well as have very significant impact in politics and policies. Dr. Derek Hamilton is a university professor, the Henry Cohen Professor of Economics and Urban Policy, and the founding director of the Institute for the Study of Race, Stratification, and Political Economy at the New School. He's considered one of the nation's foremost scholars, economists, and public intellectuals. He has recently been profiled in the New York Times, in Mother Jones, and in the Wall Street Journal. He was featured in Politico magazine's 2017 50 Ideas Shaping American Politics and the People Behind Them. And he's also a member of the Marguerite Casey Foundation in partnership with the group Heath Health Foundation's inaugural class of Freedom Scholars. Dr. Hamilton has been involved in crafting policy proposals such as baby bonds and a federal job guarantee, which have garnered a great deal of media attention and served as inspirations for legislative proposals at the federal, state, and local levels. He has served as a member of the Economic Committee of the Biden-Sanders Unity Task Force. He has testified before several Senate and House committees, including the Joint Economic Committee on the nation's potential policy responses to the COVID-19 pandemic. Pandemic-induced stress and health and economic crises. And he was a surrogate advisor for the Bernie Sanders presidential campaign and also has advised several other members of Congress and various 2020 presidential candidates. So I'm just delighted that we have a chance to spend a little time and hear from Dr. Hamilton. I'll give it the floor to you.
What a generous opening. What a fantastic symposium. What a great lineup of speakers today, previous days, and much gratitude to my friend, Dr. Siddiqui, for all her leadership, whether it's behind the scenes or out front, and even more gratitude for her friendship over the years. All right, let me get into the talk. So, realized or not, the civil and political aspects of human rights are well ingrained in our public psyche. However, at least as important is economic rights. The right to assembly, the right to speech, the right to choice. They're limited for individuals who lack basic needs like a job, adequate income, shelter, food, and of course, healthcare. Across the globe and throughout history, extreme inequality has persisted, and in plain sight, racism, sexism, and other isms are strategically used to consolidate economic and political power for some at the expense of others. This is unjust, this is immoral, and this is all about power relationships. This global pandemic reveals a collective public health and economic vulnerability of a system that actively produces inequality. But in plain sight, race and gender have been focal points. The paramount indicator of economic impact has to be first and foremost health. And in the US context, racial differences in infection and mortality related to COVID-19, they're dramatic. Our CDC reports that Black Americans have about a 2.5 times greater risk of COVID mortality than their white counterparts. With Blacks making up about 13% of the US population, and there already being over 500,000 total deaths to date, that would suggest that we've lost about 180,000 Black lives to COVID, or a surplus of 110,000 lives had we had a medical and political economy that treated Blacks and whites equally. Indeed, I wonder if the political response to the pandemic would be different if the face of mortality were less Black. In other words, race, politics, policy, and our economy in general, they're inseparable. They're intricately linked. The immoral devaluation of Black lives has been ingrained in America's political economy, and it's long overdue for a reckoning. Many Americans, and Black and brown families in particular, they have low wealth, inadequate health care, work in precarious but essential jobs, jobs that have few workplace protections, lower wages, and low benefits. Wealth impacts people's ability to respond to a pandemic. It provides the security to sustain an emergency. In fact, if you had wealth in a pre-existing condition, you could be able to make a choice to not go to work because you would sustain yourself. If you don't have that choice. Basically, wealth is the biggest pre-existing condition that we have. This crisis will only exacerbate our unjust racial wealth gap that leaves Black, Latinx, and other low asset communities behind. But this recession is different than previous recessions. Unlike previous recessions, this was born out of a moral decision to cease economic activity in order to save lives. But we have this false dichotomy that pits our economic interests against our public health interests. Again, health should always be the paramount indicator of how we define economic well-being. Still, by April of last year, the US unemployment rate had reached close to 15% or even higher, which is the highest it's ever been since the Great Depression. The unemployment rate for Black workers was about 16% in April and about 14% for white workers. So pretty much unemployment was pervasive regardless of race. Usually the rate of unemployment for Blacks is about twice the rate of whites. But as we've progressed through the pandemic, the racial pattern is reemerging. If we look at contemporary unemployment numbers, as we've begun to relax some of the social distance criteria, the adage of Blacks being the first fired and last hired is coming back into play. The overall unemployment rate stands at about 6.3%, but 9.2% for Black workers and about 5.7% for white workers. And the unemployment figures that I report underestimate the economic toll. Indeed, underemployment, being out of the labor force, loss of health insurance in the US context, which is highly attached to your job, and the mental and financial angst of unemployment are all taking its toll. It would be a lot less expensive and painful in the US context if we were to keep workers in place in the first place. But as we emerge out of this pandemic, we need a dramatic social policy transformation, including direct government hiring towards building our physical and human infrastructure so we'll be less vulnerable to the next pandemic. Or what I would like is a federal job guarantee. In a just world, race, gender, ethnicity, and nativity would have no transactional value in relation to our material, physical, and psychological well-being. Yet the heaviest toll of this pandemic, well beyond class, falls on vulnerable racial and gender identity groups, both across and within nation states. This will only serve to expand our already existing inequality and vulnerability. Incrementalism and changes on the margin are not going to cut it. To reverse these decades of generating poverty, discrimination, and economic and political concentration at the top, we need a bold overhaul of our laws and our economy. We're pretty much faced with a choice. We can continue the path of deregulation, lower taxes on the wealthy, and a gutting of government services and social welfare programs under the guise of a trickle-down supply-side economics where the corporate sector is supposed to create a dynamism to trickle down to all of us. Or we can make a profound change towards a more sustainable moral economy with government interventions that facilitate assets, economic security, engagement, human dignity, and social mobility for all its people, regardless of their race, their class, their gender, their sexual orientation, or their immigrant status. We need a new industrial policy that centers workers both domestically and abroad, coupled with explicitly anti-racist and anti-sexist economic rights. This would promote a fairer economy that would lead to shared prosperity. But our contemporary political economy has radically situated a proverbial market as a great, efficient, self-regulating, colorblind arbiter of our worth and the solution for all our problems, economic or otherwise. Under this ideology, government interventions to promote social mobility, they're deemed inefficient or counterproductive. Public provisioning to help the working class, they're purported to distort or even worse, incentivize unproductive behaviors that deter us from the productive market-like behaviors. But race, along with government social programs, they are used as scapegoats, as fuels for a neoliberal agenda. Poverty and inequality are attributed to deficiencies internal to the poor and Blacks themselves. Stigmatization based on race in an anti-Blackness frame, they're strategically used as the fodder to implement harsh and punitive control on the underclass. Blacks are the symbolism of undeserving. They're the symbolism of welfare queens, deadbeat dads, and super predators by which we define a surplus population. And what do we do with surplus populations? Rather than empowering them, we manage them. We manage them with income subsistence rather than mobility. We segregate them. We conscript them to our military. We mass incarcerate them. And we implement policies aimed at controlling their reproduction, their fertility, and their family formation. In this system of labor exploitation and political and economic consolidation, the words freedom and choice are weaponized. They become rhetorical devices intended to appeal to one's desire for agency and one's desire not to be a victim. But without capital and without power, inequality is locked in. Again, words like choice and benefit are used to describe the benefits of a proverbial market, but choice is an illusion for an individual that lacks basic needs like a job, like adequate income, like shelter, food, and healthcare. Economic freedom and authentic agency is rooted in resources. It's rooted in political, social, psychological, and especially material resources. And power and capital, left to their own devices without government interventions, they will do what they do best. They will iterate, they will consolidate, and they will leave some out and keep some in. In the US context, when we think about wealth, it's critical to note that a white asset-based middle class never simply emerged, but it was government policy. And to a large extent, entitlements, literally government giveaways that provided white Americans with finance, education, land, and infrastructure to accumulate and pass down wealth. Our unjust racial wealth gap, it is an implicit measure of the United States racist past, rooted in a history in which whites have been privileged by, and here's the key word, government complicit political and economic interventions that have afforded them access to resources and intergenerational accumulation. This contrasts with a history for Blacks, as well as indigenous people, where their personhood and whatever capital and resources they may have been able to establish have always been vulnerable to a political exploitation and an extrapolation, confiscation, destruction, terror, fraud, theft, and other acts of violence. As a result, Blacks today have very little ownership of America's land and means of production, and they remain in fear of incarceration or literally bondage. The history of disenfranchisement of Black Americans from full economic participation, it's well documented. We have policies like redlining And I could talk more about it in the Q&A for those that are curious. Highway construction, failure to desegregate schools, exclusionary zoning, they've all worked in tandem with restrictive covenants, regulatory controls to marginalize Black Americans and constrain their economic and political participation. Yet we framed our racial disparity to focus on poor decision-making and poor choices of largely Black, Latinx, and poor borrowers. The framing is tied and derived from a culture of poverty thesis in which we presume that Blacks have an undervalue and a low appreciation for education. The framing is wrong, the directional emphasis is wrong. It's more likely that meager economic circumstance, not poor decision-making or deficient knowledge, that constrains choice itself and leaves poor borrowers with little to no other financial option but to attain and use predatory and abusive financial products. When we think about debt in the US context, what we can traditionally conceive of as good and bad debt has different implications if we consider race in the prevailing framework of targeting unprivileged racial groups with inferior housing and education products, predatory finance, as well as ongoing housing and labor market discrimination that limit the choice set and rate of return to home ownership and a college degree based on race and ethnicity. So I'm talking a lot in this talk about the US context, but this really is generalizable. I hope a point that comes through that this is all about power. So in the US context, high achieving Black Americans as measured by education, they still exhibit large economic and health disparities relative to their white peers. And when it comes to health and wealth, these disparities not only remain, they grow at higher levels of education. So the fact that a Black family where the head graduated from college typically has less wealth than a white family where the head dropped out of high school, that's a property right in whiteness. The fact that a Black expectant mother with a college degree has a greater likelihood of an infant mortality than a white expectant mother who dropped out of high school, or the fact that a Black man with a college degree is 3 times more likely to die from a stroke than a white man who dropped out of high school. These are all examples of property rights in whiteness. This pattern of persistent and worsening racial disparity with education, it's not limited to infant mortality, nor is it limited to stroke. We can talk about other major diseases like cancer, heart disease, and HIV-related causes. And surely when we see the final data on COVID, this pattern will also be relevant. Yet for the most part, our economic and health literature focuses implicitly and explicitly on the lower socioeconomic status of Blacks and a perceived confluence with detrimental behaviors as the explanation for racial health disparity. In essence, few studies explore the paradox that I presented to you, that increasing racial health disparity grows at higher socioeconomic strata. The emerging consensus is that the social determinants of health, which the World Health Organization defines as conditions in which individuals are born, grow, live, and age, that they're the primary determinants of health and likewise health disparity. Hence, there's a presumption that if a greater share of Blacks invested in more and good education, that in turn would lead to better jobs, higher income, and health disparity would be dramatically reduced or eliminated altogether. But in general, Black men and women between the ages of 25 and 64 have about a 50% higher mortality rate than their white counterpart. But what's more disheartening is that these disparities increase with education, such that Black men and women with a college degree have nearly a 70% higher mortality rate than similarly educated whites. That's not consistent with the thesis of a social determinant. Just investments in education will reduce inequality. And it may be the case that lower socioeconomic status Blacks face higher levels of stress than their higher socioeconomic Black peers, but as SES rises, so may be the stress and the required coping efforts faced by these high achieving Blacks in relation to their high achieving white peers. Education matters within group, but since social structures do not permit Black people to convert education into desired outcomes at the same rates as whites, they are not protected by that social class status of education to the same extent that whites are. Racial differences in key outcomes cannot be fully explained by a clustering amongst the less skilled. Unsurprising, within group, more education leads to better outcomes. However, the irony is that across group, Blacks with a college degree are often harmed more in a relative sense than similarly qualified whites, and this difference gets amplified during recession. In essence, education is not the magic antidote for the enormous racial disparities that result from our state complicit laws, policies, and economic arrangement. This doesn't diminish the value of education. There's clear intrinsic value, along with a public responsibility to expose everyone with a high quality education. But it is a myth that Blacks don't value education, but also problematic is the societal overemphasis on the economic returns to education as the panacea to address our socially established structural barriers. In essence, we overstate the functional role of education to the detriment of understanding the functional role of wealth and political and economic power. Their physical and psychological cost of stigma, and ironically exerting agency. So when we ask people from subaltern groups to work twice as hard to overcome their barriers, we should also ask at what cost. The added efforts of stigma imposed on these high achieving Blacks that threaten the relative position of a dominant white group, it may translate into deleterious economic and health conditions. The unfortunate irony is that Blacks who put forth the highest effort to cope with their difficult circumstances may also be exposing themselves to greater risk. The bootstrap narrative framed in a politics of personal responsibility, which emphasizes individual agency, it might literally be bad for Black people's health. We do need to do a better job of understanding power and capital in our political economy. We're not atomistic agents floating in unfettered markets guided by a free will into fair and efficient allocation. We need to understand how markets themselves may be exploited to actually reinforce inequality. We need to better understand how race prejudice can constitute a strategic defensive reaction, a protective mechanism to be purposeful in preserving social hierarchy and enhancing the relative position of the dominant group. But here's a key point I'm going to try to make. To fully understand how a status quo of an iterative cycle of economic and political power may persist for so long, we have to embrace a third pillar in this relationship, and that's race, or more broadly, the existence of some permanent underclass, some underclass marked by a subaltern identity by which more dominant identity groups are willing to maintain the status quo of sacrificing their vertical positioning in exchange for horizontal positioning. In essence, as we become more unequal, the despotic appeal to white supremacy becomes more paramount. We will be willing to trade off relative status, horizontal positioning in exchange for vertical positioning. So we need a deeper understanding of how devaluating and othering individuals based on social identities like race, relative in relation to political notions of who's deserving and undeserving. That's essential if we want to expand our conceptions beyond individual transactions to better understand workings of a larger political economy. The structures of our political economy go well beyond base and individual bigotry. As a matter of course, across America and our global institutional landscape, race and other social identities are strategically used to generate hierarchy and propel systems of stratification and persistent inequality. This is the impetus for the psychological and material benefits of white privilege or the property rights and whiteness. But this privilege is based on an immoral notion of what benefit is. It's largely predicated on self-interested, neoliberal and tribal norms in which accumulation knows no bounds. An authentic racial coalition to address our common growing inequality, it would necessitate, in the US context, that the dominant white group give up the benefits of white privilege. But this is obviously not an easy ask for all the reasons that I presented to you before. To achieve racial justice, we're going to need an honest and sobering confession of the historical sins of slavery, white capping, sharecropping, Jim Crow, and the exclusion of Blacks from New Deal and post-war policies that built an asset-based white middle class. This authentic analysis would provide a counter narrative to the neoliberal frame that caricatures Black, brown, and poor people as welfare queens, deadbeat dads, and undeserving. And it would pave the way for new narratives that more accurately frame inequality as grounded in resource deprivation. Acknowledgement alone, though, would be empty if not accompanied with some form of material redress. Reparations provides a retrospective, direct, and parsimonious approach to address the Black-white racial wealth gap. Moreover, it's a racially just policy because it requires the US to do truth and reconciliation and take public responsibility for that historical racial injustice. And a seed capital like baby bonds provides a complement. It is an economically and racially just prospective approach where every child in America would be seeded with an account that they could use when they become an adult, and it would target the outcome in which whites and Blacks have very little overlap in the US context, and that's wealth. A permanent seed capital program like baby bonds would provide everyone with a capital foundation to build good health, wealth, and asset security in perpetuity and trend us towards a just and egalitarian capital and wealth access society. But what's more, we need bold, transformative, anti-racist and sexist policies that, and here's what we mean by anti-racist and sexist, by design and implementation are intentionally inclusive of all ethnic, racial, and gender groups. We need to recognize that there's a set of enabling goods and services that are so critical for life, liberty, and self-determination that their quantity, quality, and access to them should not be vulnerable to the pricing and rationing that come about from firms trying to meet their for-profit fiduciary responsibility to their shareholders. We need to recognize that government has a different fiduciary responsibility. We need public options that directly and compete with and crowd out inferior private options that don't ensure universal quality healthcare, housing, schooling, financial services, capital, and the free mobility without the psychological and physical threat of detention or bodily harm at a state-sanctioned terror because someone's identity is linked to a vulnerable or stigmatized group. Such an approach would trend us towards dismantling the material consequences and the social stigma associated with identity grouping. To be clear, I'm not calling for an end of identity or an end of affinity groups, but rather an end to its importance as it relates to material outcomes. Our current economic system is founded on the values of self-interest, accumulation with no bounds, greed, and exploitation. But our economy should be grounded on different values. Values of economic inclusion, civic engagement, social equity, human dignity, sustainability, and shared prosperity. Perhaps change is happening. For instance, we witnessed this past summer across all 50 US states and pretty much the entire globe, civil protesters shouting with solidarity that Black Lives Matter. Our younger generations and social movements beginning to redefine economic good to embrace principles of morality. These values are necessary if we're ever going to have that authentic coalition. I do not know the answer to that question, but I do know that without a potent policy alternative to what we have, grounded in economic justice that neuters racist regimes and provides pathways of economic security and self-determination for all people, white supremacy and the despotic political appeal for divisive leadership, it will remain. So I encourage us all to commit to justice, commit as a matter of faith. Timeliness shouldn't constrain us. We should not be deterred by what people think is possible by the here and now, and commit to shared prosperity, recognize that ultimately it is our monetary system, it is our government, and it is our economy. Thank you.
Thank you so much, Derek. That was a tour de force, and I'm looking forward to hearing about your experiences translating those ideas to policymakers and politicians. So I think what we might do is, I'm a little worried about people being a little fatigued and needing a couple of minutes. So we might just take a couple of minutes break and come back and start the discussion. So if everyone can come back by 11:35, that would be great. So that's two and a half minutes from now. And we'll start the discussion then. Thank you. Welcome back, everybody. I'll just get the panelists to all turn their videos on at this time, and we will get the discussion period started. Again, thank you all so much for the insights you've provided. It's really remarkable to sort of think about all the factors that are involved in making the science happen, developing good science based on good principles, and then translating that into the world, which is ultimately what we want to see. So let me start with a question that is sort of very much related to certainly Derek's presentation about our orientation and our presumptions about what the forces are at work, and becoming very honest about what those forces are. And it also relates to Deb, to your discussion of what drives politicians, what they're trying to factor in as they make policy decisions. So I'll ask you both, and Steny as well, to talk a little bit about what it is about the policy making process that involves rational decisions, that involves ideology. It seems to be that a lot of what we hear has to do with ideology more than it does to do with rational decision making. I think, Deb, you pointed out that there are moments where you see the rational thing to do, and yet it doesn't get done. So I wonder if you could both speak to this role of ideology and what it means to engage in policy, and does it mean shifting ideology, or how do we go about reckoning with that? And I know, Derek, you've had a lot of experience consulting with politicians, so it'd be interesting to hear your thoughts from that perspective as well.
I guess I'll jump in. Seems like that was targeted to me. I'll say, I think Deb has it pretty much right that politicians don't get into politics to be evil, that they may be good-hearted people. Of course, there's heterogeneity across any population or any group. But the point is, we make them do certain things, that they are responsive to movements, and they are responsive to political economies in general. So, we have a lot of people in the United States Senate that were in the US Senate 10 years ago, and they might be talking about things a little differently. And sadly, on both ends of the spectrum. But, I'll say, for example, just to make it cogent, who would have thought that Joe Biden would be the person who centers race equity for the first time, at least in my lifetime, and I think the history of the United States, that we hear rhetoric around race equity. Clearly, the jury is still out on what we're going to do with it, but This is just, to me, providing an example of the fact that politicians are indeed people, and ultimately to seize power, we need good politicians, but we need movements, and we need to seize larger political economy strategies.
Great. Thank you, Deb.
Unmute. So politicians are people, and remember, in Canada we call it the House of Commons. It's called the House of Commons because they're common people, right? So the makeup of the Parliament should be, and is for the most part, in some ways, in other ways not at all, reflective of the people that elected them. So it's not an expert body. It's a grounding body. It brings people back to the people that we're there to represent. So I think we have to remember that public opinion really matters. And when politicians go back to their communities and they talk to people and they talk to their family members, they talk to their neighbors, they get a sense of what's important, what's resonating at home, and they do and should bring that back. So let's remember that that they have a job to do, and that job is that reflect their community. At the same time, a job of researchers and the people around researchers is to educate politicians, and not just politicians, so that in a perfect world, when they go home, they hear what they have learned, been educated about, reflected back to them from their community. But I can tell you, I went into politics with a clear social justice perspective. That's why I ran for office in the first place. I worked a lot on poverty reduction. I could count on two hands the number of times I heard about poverty reduction at the door when I talked to people. I'd meet with a few little groups, church groups in particular, faith-based groups, who would care about the issue, but I never was able to get the public talking about it. So we just did it and hoped it didn't hurt us.
Oh, that's fascinating. Staney.
Yeah, so I guess, short answer is probably yes. I guess the longer answer is yes, and how. And, I want to pick up on something that Dr. Hamilton, something that Dr. Matthews said. So they both keep on talking about how you know what's happening, right? Like, what are the actual measures? How do we know? How do we know about what is occurring? And Dr. Matthews talked about this idea of what are the key performance indicators for this policy, and being kind of, I think, gobsmacked that there wasn't one there. And when Dr. Hamilton's talking, he keeps on coming back not to what the idea is, but what the data are and what they show. I think one of the ways that we can really push this is just constantly instrumenting what's going on, right? Like, what is this policy actually doing? What is actually happening here? What is the actual sort of distribution of any sort of type of outcome that we value as a society? And then for the most part, it becomes harder and harder not to do the right thing. It's still really possible to do the wrong thing, but I think it does build a little sort of firmer platform for it. And so I think, there's lots of ways to change the how, and I agree with everything that's been said so far, but I think we do need to put numbers on it, and we keep on finding ourselves, I don't know, pretending to be surprised about the inequities that we see. And I don't think that's allowable anymore.
That's great. Thank you. Derek, were you going to say something?
Yeah, I mean, I'm going to push back slightly, Deb, on the notion that politicians are common people. I know we say common House of Commoners, but there's nothing. Politicians are elite and powerful, and I think it's not. We should recognize that. Academics are elite and powerful, and we need to also recognize that our scholarship doesn't just happen in a purist, vacuum scientific approach. That we're not immune to the times of who the funders are, the times of what the dominant discourse is in order to get published, that there is this power structure of status quo that we got to recognize that's intended to, do what capital does best. Without some form of intervention and without people power, what we will have as a default is a concentration, an iteration, and an exclusionary system. So I agree that politicians are vessels, but people have to push them to change. They won't do it on their own. And then the other point is that politicians very well could be part of the problem in some cases where they're coming, the influence of money in politics, for example, right? So I know I'm not saying anything we disagree with there, but they're not common. That's the one point I'm trying to make.
Could we agree that they're common people with extraordinary power and influence? And the reason, and one thing to look at is look at politicians after they've left politics. And it takes a while, but usually they tend to go back to, at least here, to pretty ordinary jobs.
Interesting. Yeah, interesting conversation. There's actually some great scholarship in the US about the socioeconomic distribution of congressmen, of senators. Nicholas Carnes, for example, at Duke has done some interesting work about Derek's point that they tend not to come from lower socioeconomic strata, for example. So the next question, and I encourage our audience to keep adding questions to our Q&A, and we'll try to get to as many as we can, and I'm sort of combining a lot of them into the big ideas they speak to. The next question is about something that I think goes to the heart of the matter in terms of the population health science, and that is that income, and as Derek points out, wealth are so fundamental to almost every health outcome of which we know. And this has been well known for a long time. It's one of the sort of benchmark findings in population health research. We see governments who have given nods to this research, and yet what we have seen over the past several decades is growing income inequality, stagnating and declining median wages at the low end, and massively rising income and wealth at the high end. How do we reconcile that, but also how do we change it? What is it that we can do to get some traction there? I know, Dr. Matthews, in your administration under Kathleen Wynne, there was a basic income pilot that started and ended. Can each of you talk a little bit about your thoughts around policies? Derek, you've had so much engagement around these issues with Democratic primary candidates and so on. Staney, you've done this work with Ministry and Community and Social Services and other ministries. What is it that we're dealing with here? What's going on, and how can we make real change? Maybe I'll start with Staney.
So, I think in terms of sort of what's going on, I'll just refer back to Dr. Hamilton's talk. I think that's sort of the simple question here, but I think, how do you kind of break this open? Well, I don't think there's sort of a single key to kind of breaking this open in any way, but I think there are really good options for starting to work on it. And, I actually think something like a baby bond is eminently saleable politically. Like, I actually see that as something that I think a lot of people could kind of understand and get behind. I think the idea of the basic income is also, I think, something that, people can kind of get behind and understand. And I think that's why you saw like a lot of challenge when it was canceled initially. But I think, it's been very interesting to me, right? And it's maybe a bit of a microcosm here, and it may get back to kind of what Dr. Matthews was talking about when she said, they didn't know what their goals were. They didn't know what their indicators were. I actually find a lot of governments come forward with policies that don't really have a coherence to them in a lot of ways, right? So it's not about let's drive equity or let's drive the economy. There's still very much a collection or sort of a quilt of policies that often come forward. And so I think the more we get people focused on kind of what the big goal is, you'll actually find a lot of ability to kind of measure and monitor and bring in all these sort of tools like, say, a baby bond or a basic income behind them. There was I think to be fair, there was actually at the beginning in 2003 and 4, there was an attempt to kind of report out regularly on these big goals, which was great.
Yeah.
But we kind of let that slip, which I think is a real problem, because, constantly coming back to reporting on whether you're doing well or not, which, not everyone does well all the time, right? It becomes very hard for a politician to keep on sort of ordering this stuff that at times kind of shows how poorly you're doing. It may be, as Dr. Matthews suggested, it may be good to kick it somewhere else, like a Washington State Institute of Public Policy that, is kind of protected off on its own and keeps on reporting on stuff. But some big tracking like that would be really important. The only other thing I think is really important to point out is that tracking has to be at a level that it matters to people, that they actually sort of see themselves in the data. I don't really believe in provincial reporting or state level reporting or national level reporting, because I don't think anyone sees themselves in that. It's easy to say that's someone else's problem. I think people need to see themselves in the data. But again, I'm reflecting the soul of an accountant here, Arjun. I just like to count everything. So,
but if I can, Steny and I worked together on something called the Excellent Care for All Act, and it required hospitals and other healthcare providers to publicly report on quality indicators. And Steny convinced me that people who work in healthcare cannot stand to be worse than their peers. They all want to be better than their peers. And the only reason they know how they were doing relative to others is if we publicly reported the data. So it really drives change when people can see how they are doing relative to others.
That's really helpful. Derek?
I think Steny is spot on in that we need to define the goals up front. So first and foremost, we need to redefine economic value to represent a lot of the things that we're talking about here, which is human flourishing, which is human dignity. We have somehow treated this as a values-based proposition, juxtaposed against more responsible propositions of GDP per capita. But GDP per capita is a values-based proposition. It's a normative frame. So my discipline has pulled the wool on everyone's eyes in thinking that we're strictly positivists, that economics is all about science and not grounded in values and an initial position. Everything starts with some value. So that point number one, I think we need to full-throated describe what a well-functioning society is and, change the narrative. And this leads to the other point, which is the other, I'm going to say the other side because I'm competing against it, has captured a narrative to talk about the functionings of a market of sorting those into outcomes based on who's deserving and undeserving. I think an economic rights frame presents an alternative. I think an economic rights frame says that at a base level, what do people need in their lives? And to get to that economic rights frame, we would have started with the values in the beginning that Steny defined. So I can talk about specific policies, and the specific policies come about from, they're not so complicated. They're pretty obvious. If the source of inequality as it relates to wealth is capital, then we see children with capital at birth. We complicate and nuance the issues based on politics, based on things like our ability to define who's deserving and undeserving. And, if I'm all over the place, I'll try to sum it up with this point. Our economy, our politics, and what I'm trying to get across, the ways in which we stratify individuals based on social identity are all inseparable. And when we think about them in their confluence, we're better understand to figure out dynamics so that we don't end up in immoral situations where we can sell narratives that are inaccurate, narratives around the source of inequality being behavior, as opposed to the reason why people are poor is they don't have enough income. So the direct solution to poverty is to make sure people have enough income. The reason why people don't have a job is because there aren't enough jobs. The direct source to addressing job inequality is to ensure that there's enough jobs. So if we're able to understand the ways in which we move away from these obvious solutions is by using weaponization of things like social identity, I think we're better able to confront it and come up with solutions that really do lift everyone up.
That's really helpful. Staney, yeah, go ahead.
Yeah, so just, I think there's something very important in the way that both Dr. Hamilton and Dr. Matthews are talking, right? And it reminds me of something that my first boss said to me. He said, I really want to have a one-handed academic. And so I said, what do you mean? He goes, we all say on the one hand and then on the other hand, right? And so I think sometimes we undo our own efforts because we raise uncertainty that makes it easy to kind of back away from some of the things that we discuss, right? We frame it always in a very thoughtful, mature, and nuanced way, but it makes it easy to kind of disengage. And I think kind of one of the things that we need to do, and you heard it very much in the way the other people were speaking these days, is when we are comfortable with a statement, make it. When we are comfortable saying what is right or what is wrong, both the other speakers have framed these things always in a moral sort of way. Make that clear. This is what we need to do. And it's a real challenge for scientists and sort of researchers sometimes to communicate that way. But I think it will help shift a discourse. You never want to get out beyond what you know. You never want to say something that you think might be true, but you're not sure. But I think when we do get to that level of comfort, it's better for us to be very precise about what we mean and very clear about what we mean and not raise the other hand all the time.
Fair enough. I'll just pose one more question to each of you, and then we'll just move on to some closing remarks from Dr. Mabel Carbali, who's the co-host of this series, and then myself. So my final question to each of you is to ask you whether you can share with us some success that you've had, or some learning or insight that you've had that you think, either an example, a moment in time, or a general lesson that you've sort of taken away from efforts that you've made that perhaps we could take forward with us, that perhaps will inspire our audience in terms of what they might be able to do. And perhaps Dr. Matthews, I'll start with you this time.
Such a hard question, and so many things come to mind, but I think when I look back, introducing the Ontario Child Benefit was one of my big successes, which is $120 or so per child at maximum. When I was doing consultations for the poverty reduction strategy, I remember so clearly a woman just said to me, "Deb, you got to understand one thing. We're poor because we don't have enough money. We don't need more programs, we need more money." And that was what actually drove me from that point on to say, it's not about programs, let's get more money into the hands of the people who need it for their kids. So I guess the learning from that is those consultations, you learn a lot when you actually talk to real people who are living the life you're trying to help make a difference with.
That's helpful. Thank you, Staney.
I think probably it's spending time on building relationships, right? Whether it's by providing support or answering questions or anything else, this all happens through people. And so if you don't build the relationship, you're kind of lost. And it's at times, it really requires you to focus on what it is you can bring to that relationship, which, is, I don't think politicians are ever looking for an extra friend. They're not looking for someone to kind of have coffee or a drink with, but they are looking for someone who will give them very straight, reasonable advice. And when you can do that and not bring an agenda into it, just bring the science, I think you can actually build a good, solid, long-standing relationship. And so, although it doesn't often get considered in tenure or promotion or publication track records, the more that I think we can encourage that for folks, the better we'll be.
That's really helpful. Derek?
In the tradition of Staney, I'll say full-throated, I'm committed to economic justice. And I'll say that pessimism impedes upon progress and leads to the status quo. Yeah. People just throw their hands up and don't do anything. So, am I optimistic? I'd say I'm hopeful. I'm sobered by I'm humbled by a great deal of success that's taken place. We've been talking about federal job guarantees, reparations. We've been talking about guaranteed incomes for a long time. But we're at a moment in time where it seems like those ideas are gaining some saliency. But we're also at a moment in time where we have President Trump, who said some mean things, who said some awful, horrible things about building walls. We saw putting people in kids in cages. So, I'm not naive to think that this stuff will necessarily happen, but I'm really optimistic, and I feel like we've had success. And I don't know if it's a confluence of a younger generation that has realized that they've been sold a bag of goods and thinking that investments in the top end of the market will simply trickle down to them as they face a great recession, record levels of student debt, and now another pandemic recession, or if it's just a change in values among young people where they say, you know what, we care about economic justice too, and there's certain vulnerabilities we're just not going to tolerate. We're going to set at least a baseline, whether you're a market person or a socialist person. At a baseline, we're going to start with this level of economic justice. I don't know, but I am optimistic. I am hopeful about the moment we're in.
Well, I know that every time I hear about Cory Booker's baby bonds project or Bernie Sanders' job guarantee, and I think, no, that's actually Derek's proposal, I do get hopeful. So it's wonderful to see that progress. I want to close this discussion just by saying a huge thanks to our panelists for such engaging talks, such an engaging conversation. I think it's really important that we have moments like this where we reflect on politics and policy in the same breath that we reflect on the science. So my deepest thanks to all of you. We are now going to turn to Dr. Mabel Karabali, who's been the co-host of this series, who will start us in thinking about some of the closing learnings and so on that we've had throughout the course of this series. So I'll turn it over now to Dr. Karabali.
Thank you, Arjuman. I think I was talking and I was mute. Thank you, Arjuman, and thank you, everyone. Thank you, our panelists from today for this great discussion. I will also like to thank every panelist and every attendee from our day 1, 2, and 3rd. We have great insights. We have great participation. We have around more than 1,000 individuals registered in our event, and we have participants from around 30 countries around the world, which is great. We observed that according to the polls, we were able to register some information. We have a huge participation from students and trainees, but we also have the participation from policymakers. It will be interesting to see the proportion of the participation given today's talk and discussion. I will also like to share some of the responses from our panelists, and it's evident that one of the key actionable areas for work are policymaking, either if it's improving upon what we already have or what people consider that we need to transform completely. Those are just my main comments from our virtual symposium. I want to thank you again, everyone, for your participation. Please stay tuned. Look at our YouTube channel for the recordings of these sessions and all past sessions. And we are trying to work to collect all this information, all the analysis, and all the experiences from our panelists into a volume. So we want just to invite you to stay tuned and to look up for the results from our event. Thank you so much.
Great, thank you so much, Mabel. So I just want to leave us with some thoughts about what we've experienced over the last 4 sessions. I really think that the speakers have made this time really fruitful for us. For me, and I hope for all of you, the sessions really have been a chance to take a step back and reflect on some of the big picture issues in our field. In session one, we examined what has come before this moment. What are the main questions, the main findings that have animated work in our field? And to tell this story, we had Drs. John Frank, Ichiro Kawachi, two of the most important figures in the history of population health research. And we also had renowned sociologist Dr. Michel Lamont provide a context for understanding how the social and economic inequality that affects health might operate. In session two, we turned our attention to racial health inequalities, and these were not inequalities that were featured prominently in the beginning of the population health movement, and now we know just how important they are. And we heard from people like Dr. Ana Diaz-Aruz, who again is a very significant scholar in population health research, and we talked about the importance that we've learned about the social context and about understanding causal mechanisms related to health inequalities. Dr. Roberta Timothy told us a lot about the groundbreaking work that's happening in Canada to understand more about the relationship between race and health here. And Dr. Sandy Darity provided a really forceful argument about the importance of considering not only income but wealth, as did Derek Hamilton today, and also a compelling case for looking at the role of reparations as a means for addressing racial health inequalities. In session three, we did sort of a combination of taking stock of our field and doing some forward looking and asking what the issues and big questions are that are facing us. Dr. Sandro Galea, again, a very important figure in our field, spoke about the importance of economic conditions and of making sure that we really try to tie our research to the issues facing our societies and potential solutions. Dr. David Williams, who's a pioneer on the work on racial health inequalities and certainly one of the most important figures in the field, spoke about what we've learned about racial health inequalities, about the basic pattern and about the role of racism and its effect on biological well-being. But he also talked about some important new findings that indicate twists and nuances we need to know much more about. And Derek, again, alluded to those today as well. For instance, he spoke about research that's showing improvements in some clinical health indicators for Black people whose socioeconomic circumstances have improved, but at the same time that those people often experience declines in physiological health due to the stress and strain of achieving, essentially. And finally, Dr. Michael Stepner, who we are lucky enough to have joining us at University of Toronto, and who's worked with Raj Chetty's group at Harvard and has already been so influential, reminded us how tethered health status is to broader systems of social welfare, and that this relationship is bidirectional. And finally, today, we've heard from 4 fantastic speakers about how all of this research could or should be freed from the confines of academic journals to make its way through the public and political discourse. And I'd like to add that I think at some level, what we've heard is some very significant insights that have developed over the past several decades. We often say that we must go beyond documenting patterns of health inequalities, and indeed we must. But I think what we saw is that this repeated documentation over decades is partly what's informed us, that there is a massive central phenomenon of health inequalities. It's not a one-off. We've learned that this is an organizing principle for understanding population health. We also talk a lot about needing to move from individual determinants of health to understanding structural conditions that shape population health, and indeed we must. But we've also seen how much we've gained from documenting the social to biological mechanisms that drive population health. It's because of this work that we know behavioral interventions are simply insufficient, because social determinants and societal determinants operate on the body in so many different ways, and that it's all but futile to boil things down to behaviors. Or that different aspects of health, from physical health outcomes to physiological stress, may be simultaneously moved in different ways by social conditions. that really challenges some of our broad conceptualizations about how this all works. And finally, we've learned that societal conditions matter and engagement with society matters. And I would argue that a common thread throughout the sessions was the importance of turning more of our focus to these issues and to developing a broader conceptualization of what conditions we consider, what interventions we consider. And I'm excited about taking these ideas and moving forward with them and watching others do the same. And now, just for some thank yous, we want to certainly, again, thank all of the remarkable group of speakers who were so generous with their time and their thoughts. We thank Drs. Vivek Goyal and Staney Brown, who have provided a lot of support as this series was being formulated, and throughout the series as well. In addition, the entire team at the Dalla Lana School of Public Health, including Francoise Makanda and the communications team, Robin Hurst, Pierre Lee, Madeline Salazar, and the financial logistics team, Kelsey Chatterson and the entire bespoke audiovisual team, Victoria Tan for handling social media for us, to Mebel and my intellectual home, the Social Epidemiology Lab, for all the inspiration and support you've given us. And last but certainly not least, our thanks go to you, the attendees. We are so incredibly glad and grateful to you to have been able to share time and space with you. And we're very much hoping that these sessions spark discussions within your own circles and institutions and inspire you to connect with the larger population health community as well. One final thought, as Mebel mentioned, we are aiming to produce an edited volume based on these sessions. So you haven't heard the last of us yet. So again, thank you so very much. Take care, and we look forward to seeing you again soon. Bye-bye.